Let's talk a little bit about sports psychiatry,
Yeah,
sports
awesome.
psychology, and really what clinicians can borrow. So, for a medical audience, how do you define sports psychiatry versus sports psychology, and where do those two disciplines most usefully intersect with real world care, but care for the non-athlete?
Yeah. So I kind of think about it in the same way that, when I talk to individuals about the difference between like general psychology and psychiatry, we play a lot of roles and are working to ideally treat a similar population, in this instance, athletes. But from a psychological level, they have limitations on the different therapies they can do, the different treatment modalities, where psychiatrically we recognize that, yes, therapy can help people, but there are a specific subset of individuals who need more additional support. And so, from our standpoint, from a sports psychiatry standpoint, we're thinking about what does that look like, and in combination with, there's a lot of restrictions that athletes have based on the medications and the treatments that they are afforded. And so there's a thing called a TUE, a treatment use exemption, where let's say somebody has ADHD, they have to get specific documentation, specific treatments, evaluations, so that they can get the stimulant treatment that they need. With the idea being that you don't want somebody without that to have a stimulant, because then it can be used as a performance enhancing substance and kind of make the playing field not even. So there's a lot of nuance in trying to decipher, okay, I have somebody who, let's say, I'm treating for ADHD or I'm treating for depression, and what are the side effects that they may experience with these treatments, and how does that either allow or align with the rules and regulations of whatever sport or profession they're in. Do they need a TUE or treatment use exemption to, excuse me, to get this treatment? um, or how are they going to respond? So it's more so looking in that direction, while recognizing that there's a lot of sports psychiatrists who do a lot of like peak performance, eye of the tiger, more therapy based treatments as well. And so being able to kind of juggle that, I think, is really where sports psychiatry fits in.
What are some core sports psychology tools like imagery, arousal regulation, self talk, goal setting that you find general psychiatrists could and should be using with non athlete patients as well?
I think one of the big things is recognizing that athletes are all about activity. They're playing sports, they're playing basketball, football, soccer, or whatever it is. So they're very physical individuals. And so any way that you can incorporate movement into their treatments, I think really pays dividends for them. And I think specifically when we think about cognitive behavioral therapies, there's the thinking portion, there's the emotional portion, and then there's action. And so that's usually where a lot of people in a psychological space may start with athletes, because they're very regimented. They're very much, if you tell me to do something, I will do it. There's handouts you can give with CBT workouts that it's like, okay, here's your homework. You do this, you come back to me, we're going to talk about it. And so thinking about it in that way, because we recognize that actions can also get a emotional response. If you're upset and you smile, that alone can actually change your mood and put you in a better mood. We know that there's an interesting dynamic where, let's say, you're having an interaction with a patient and they're crying. The polite thing to do is pass them a napkin so they can wipe their tears, blow their nose, whatever. But psychologically, you have to think about, if you're crying, especially in a deeply saddened state, excessively crying, moving is actually going to break that cycle for most people, and will actually cause them to kind of stop crying and recollect themselves and kind of step out of that moment. And so, in that same way, you can recognize how important movements are. And so, I think incorporating that in non-athletes, but especially for athletes, can pay a lot of dividends.